What's the truth behind oral sex? Are the myths real or just fiction? In this podcast, we explore if genital scent can deepen intimacy and why challenges around oral sex still exist. Get ready for thought-provoking insights. What are the myths around oral sex? In the context of sexual experiences and expectations, there's been a prevalent assumption that women should experience orgasms during penis and vagina intercourse just like men do. This perspective has wrongly led to the belief that if women do not orgasm during intercourse, there is something wrong with them. However, the reality tells a different story. Statistically, about 30% of women can reliably achieve orgasm through intercourse. The remaining 70% may sometimes, rarely, or never orgasm in this way, yet they are perfectly healthy and normal. Women can achieve orgasm through various other means, such as manual sex, oral sex, the use of vibrators, breast stimulation, or even toe sucking. Essentially, there are myriad ways to reach orgasm, and not achieving it through intercourse is entirely normal. Another human sexual experience misconception is centered around genital responses and mental arousal. Generally, a man's physiological and mental states tend to align. If he is mentally aroused, his genitals reflect this by becoming erect. This led to the flawed assumption that women should experience the same kind of alignment. However, in many cases, women might experience arousal non-concordance, where their genitals' physical state, wetness or dryness, does not necessarily match their mental state of arousal. A woman can be fully normal and healthy, even if her genital response doesn't mirror her psychological state of being turned on or not. Similarly, there's a misconception about sexual desire, namely that women should experience spontaneous sexual desire just as men often do. The reality is more nuanced. Some women may never experience spontaneous sexual urges, and instead, they might feel sexual desire only in response to specific erotic stimuli. This is termed responsive desire and is completely normal and healthy. It's important to recognize that while there are differences between women and men in terms of orgasm, desire, and arousal, there are also many similarities. Both genders can experience orgasm, possess sexual desires, and get aroused. Men, too, can experience responsive desire and arousal non-concordance, and they may also struggle with achieving orgasm through penetration alone. Women and men both have the capacity to fall in love, engage in sexual fantasies, masturbate, feel confused about sexual norms, and enjoy extreme sexual pleasures. Both genders can secrete bodily fluids, fantasize about unorthodox sexual scenarios, and be surprised by how sex manifests in their lives, as well as how it sometimes unexpectedly fades. The sexual experiences of both men and women are complex and varied, making it essential to understand that while there are differences, there are also significant overlaps in how both genders experience and navigate their sexuality. Can genital scent in oral sex enhance intimacy? Normal genital odor plays a significant role in intimate moments, such as a genital kiss, for both partners. It is important for both individuals to maintain good hygiene by washing regularly, yet not necessarily immediately before the act, so that they can communicate openly if the natural scent becomes disagreeable. This natural odor can be altered by contraceptives as well. The market for products like intimate deodorants and vaginal wipes shows a lack of understanding, as they mask the natural scent that is often preferred. Rather than trying to mimic unfamiliar scents, such as peach, seaweed, or musk, it is best to embrace one's unique cassoulet. Many women are unaware that their natural scent can be a powerful allure. Some men respond strongly to these natural pheromones without even realizing it. Hence, using a dab of natural scent behind the ears at social events can be very effective in attracting a partner, possibly even more than traditional bottled perfumes. Contrarily, a man's natural scent tends to be more appreciated by his partner as the relationship deepens. Again, while regular washing is recommended, deodorants should be used sparingly to avoid diminishing the natural scent. It's difficult to understand how the belief among the hippie generation that good sexual experiences could occur without proper hygiene developed, as cleanliness is key to healthy intimacy. For women, enjoying and reciprocating intimate oral gestures can be vital components of sexual satisfaction. She might straddle her partner and give herself to him passionately, with slow and deliberate movements. He might stimulate her with long tongue strokes from the vagina to the clitoris, adding extra stimulation as he reaches the clitoral glands each time. Alternatively, he can try the cascade position if she is able. This method involves standing while performing oral sex, a variation of the 69 position but upright, which can provide the woman with the unique sensation of experiencing an orgasm while head down. He would lay her face up across a bed, with her head hanging off the edge. Standing over her face, he would lift her legs around his neck and support her. As she approaches orgasm, she could either continue the genital kiss or stimulate him in other ways, such as with her breasts or hands, allowing herself to fully enjoy the orgasm. For an inexperienced woman, there are other ways to approach this intimate act. Traditional kneeling in front of her may appear appealing but does not allow for deep stimulation. Instead, she can lie face up on the bed and he should sit at the edge, half turned towards her feet. He could start by kissing her all over, gradually working his way to her farther leg and foot. By slipping his elbow through her raised knee, he can open her up and begin with gentle kisses on her closed labia, deepening the kisses as she becomes more aroused. Over time, fewer women feel inhibited about receiving such intimate kisses, but many may still struggle to reciprocate the pleasure. Prolonged genital kissing is often necessary for some women to fully achieve sexual pleasure, a fact acknowledged in Indian love literature. If either partner feels shy, it is still worthwhile to try, even in the dark, as these acts can lead to heightened intimacy. For men, receiving spontaneous genital kisses from a partner stands out as one of the most profound and moving gestures in sexual experiences. Good oral techniques by a woman can be considered one of the greatest gifts she can offer her partner, underscoring the value of practice and spontaneity in perfecting such skills. What are the challenges of oral sex? Engaging in simultaneous oral sex, commonly referred to as 69 or 69, can be enjoyable but presents certain challenges. Due to the need for focused attention and delicate technique to please your partner, you can't be as uninhibited as during mutual intercourse. For women, an impending orgasm might clash with the careful technique required, and men risk being inadvertently bitten. Additionally, some men might find a drawback related to the position of the woman. When she's facing the opposite direction, it becomes challenging to perform precise tongue work on the more sensitive areas of the glands. This dilemma has been depicted in some acrobatic poses seen in Indian temple statues, designed to achieve mutual pleasure as well as a better position for the woman. While mutual genital kisses can be incredible, it's often more effective to take turns if orgasm is the goal. For some couples, simultaneous oral sex can be the pinnacle of sensation, but it's crucial for the man to ensure beforehand that his partner is comfortable with the possibility of ejaculation in her mouth. The commonly depicted woman on top position can work well, especially if combined with hand stimulation, but it may cause discomfort such as a stiff neck for the man. A particularly effective and comfortable position involves both individuals lying on their sides, head to tail without cushions, and using the partner's upper thigh as a cushion for the head. The man can create more openness by slipping his arm into the crook of her upper knee. The duration of mutual kisses can vary greatly. They can be fleeting or extend for several minutes or even hours, depending on personal preferences and the desired pace. Whether brief or prolonged, these moments can fit nicely between rounds of intercourse, serving as either a prelude or a revitalizing interlude. In the case of alternating oral sex, starting with the man pleasuring the woman in the no cushions position is often recommended. The woman can remain relatively passive initially, and then take her turn afterward, or they may proceed directly to intercourse. Post-orgasm, after a rest and when ready for his next erection, they can return to fellatio, allowing the woman to fully focus and perfect her technique. Regarding birth control, it's worth noting that the discovery of hormonal contraception significantly revolutionized sexual freedom. Prior to these modern methods, couples utilized less reliable techniques such as using crocodile dung to block the vagina or employing animal intestines as condoms. Anxiety about potential pregnancy often hindered the enjoyment and prolonged engagement in sexual activities. In the past, there was a saying that described the precariousness of those times. Couples would engage in reckless sexual acts on Saturday night and pray on Sunday morning that they wouldn't conceive. Modern methods, providing a sense of security, have allowed women and their partners to explore and enjoy sexual play more expansively. The responsibility that comes with these freedoms is understanding the method's usage and possible side effects, which necessitates professional medical consultation. The most popular contraceptive method remains the pill, despite requiring daily attention. Alternatives such as hormonal injections, implants, patches, and their various combinations work similarly without the need for daily remembrance. Injections and implants are more long-term, so it's crucial for the woman to ascertain that she doesn't react adversely to the hormones before opting for these methods. Emergency contraception, available up to 72 hours post-intercourse, the pill, or 5 days, an IUD, is also an option during contraceptive mishaps. Contrary to myths, it is often used not by irresponsible teens but by busy individuals in their 40s who might forget the pill or experience condom failure. Thanks for tuning into our podcast. Follow us for more podcasts like this and explore fresh, exciting topics every day. With over 1,000 free podcasts on our app, there's always something new to discover. Just grab the link in our About Us section. Don't forget to rate our channel and share your thoughts. We'd love to hear from you.